Assalamu alaikum everyone. Welcome to our veterinary YouTube channel. Today we are going to discuss a very important and very interesting clinical case of bottle jaw in a goat. You look here, soft swelling beneath the lower jaw due to accumulation of fluid. Actually, it is not a disease itself, but an important clinical sign indicating underlying systemic illness. During history taking, the owner reported that the goat had gradually developed swelling beneath the jaw over the past few weeks. On the basis of physical examination, animal shows very weak, dull, and losing body condition slowly. Feed intake was reduced, and goat showed discomfort while studying and walking. The owner also told that deworming was done according the advice of a veterinary doctor. Here I would like tell that history taking is very important in veterinary practice because it helps us to understand the possible causes of the disease. On the best owner history, the animal did not recover even after deworming treatment. The questions may be raised in the mind that the goat is suspected to be suffering from maybe severe systemic weaknesses and maybe chronic anemia, protein deficiency, liver disorders, kidney disease, malnutrition, and sometimes internal tumors or chronic inflammatory condition as well. After a complete physical examination of goat from head to tail, I decided to further examine the body by using the stethoscope. Slowly, heart sounds were checked, and mild weakness of the pulse intensity was observed. Respiratory examination was also conducted using a stethoscope to evaluate lung sounds and breathing pattern. So after general examination, detailed abdominal palpation was performed manually using gentle hand pressure. During palpation of the lower lumbar side of abdominal region, a firm and hard mass was detected internally. This mass appeared painful on pressure, and the goat showed discomfort during deep palpation. The hard consistency and reduced mobility of the mass suggested the possibility of internal tumor, maybe intestinal growth, or maybe the chronic inflammatory masses. So this was very significant clinical finding requiring further investigation and treatment line. Dear all, you look here on the base of finger palpation, mild given force, this area, there is a big mass, both sides we can feel. So this is the final approach toward the real situation and the problem of this goat. So I concluded that this is the big mass, maybe the tumor present around the small as well as large intestine, especially cecum side of the large intestine. So I advised the owner that this case require maybe advanced diagnostic evaluation and possible surgical intervention to treat this critical problem. Therefore, I would like to say that bottle jaw should never be ignored because it is usually a sign of serious underlying disease. In this goat case, the detection of the hard abdominal mass highlighted the importance of through clinical examination and timely surgical planning. Dear all, thank you very much for watching this clinical veterinary case discussion. If you found this video informative, please like, share and subscribe to the channel for more veterinary, clinical and surgical case studies. Once again, thank you very much. Take care. Allah Hafiz.